school psychologist friends. It's Rebecca Branstetter here, and I'm very excited to be with my wonderful guest, Dr. Bryna Siegel, who is a renowned author and of this fabulous book, Helping Children with Autism Learn, and she's just come out with a great new book called The Politics of Autism. And this is going to be something we're going to chat about in a moment, but I want you to introduce yourself first. Tell us a little bit about what you do and introduce yourself to the world of school psychologists out there.
Well, hello. I am a sort of a strange hybrid of things. I have a PhD in developmental psychology and also a master's in early childhood education, and for 25 years was a professor of child psychiatry and started an autism clinic, first at Stanford and then at University of California, San Francisco, which is where I met Becky.
Fun fact, my old boss.
And have always been really interested in how to assess children in a way that the assessment results get translated into specific recommendations that teachers and parents can use as opposed to just test scores. And so this, for me today, is a great opportunity to talk about my approach, which is really to look at the symptoms of autism as a collection of autistic learning disabilities and autistic learning styles, the strengths and weaknesses of kids with autism, and then how do you map them onto the different tools that you all are used to using in terms of developing accommodations and IEP goals and so forth.
That's a great intro, and one of the things that many of you out there know is that I also have an online course and a professional learning community called the Thriving School Psychologist Collective, and in that collective we look for thought leaders in certain domains and reach out to them for these coffee chats. And I had them ask me, what are your burning questions about autism? Because really this is the go-to gal. And oh my God, that's so adorable. I just heard the little San Francisco cable car outside. How quaint is that? But yes, so I wanted to present with you a couple of questions that my school psychologist colleagues wanted to ask. And then I want to give you an opportunity to share out a little bit more about some of the goodies in your book. So I'll start with one of my school psychologists was really interested in the assessment process for autism, and what she's finding that she wanted me to ask you is that a lot of times there's really discrepant information in the rating scales. So parents have a very different rating scale than say the teachers, or her observation of the students is very different than a parent's rating of the student's behavior. And she was wondering, how do you reconcile that?
It's a really important question. For one thing, parents don't have the same knowledge base, obviously, that a school psychologist does. Importantly, and everybody who's done, obviously any training as in school psych, you learned about both reliability and validity. And a lot of the emphasis on developing these rating skills has been on reliability. Can two people rate the ADOS and get the same score? Mm-hmm. And not so much on validity. And validity meaning that what you're measuring turns out to be true across settings, that it really is a trait of the child. And actually, in many times, school psychologists sees the child at recess. They see them in the classroom. They see them interacting with the parent as they are trying to talk to the parent. Whereas the parent has, in some ways, a more limited window on the child, number one. And number two, we all know that children will do things with their parents, that good and bad, that they won't do with other people. Mm-hmm. And we also have the fact that a lot of parents who are dealing with IEPs or 504 plans don't have other children, or they don't have older children. And so when you ask them to make qualitative judgments about whether their activity level is too much or too little, what are they supposed to be judging that against? And so you can end up with ratings that are very different from a teacher's rating, which might be due to the fact that the child is different in each setting, but may be due to the experience and perspective of the parent. And so knowing something about that family, Becky and I were just talking, and I was saying, well, okay, if a parent has an older kid, a younger kid, and the kid in question has a identical twin, maybe that parent's report is going to be reliable as to how active or how social their child is. Mm-hmm. But below that, there's going to be compromises, and you need to have evidence coming from more than one setting, and sometimes the teacher's rating is going to be more reliable. Sometimes just getting a rating from the father as well as the mother, or a grandmother as well as the mother, and just getting a sense, And it's not that the parent is bad or wrong, but they've got a different perspective, and that gives you information for starting to work with that parent about how they're seeing the child versus how the child is or how he's being seen in school, and the changes the parent needs to do in their thinking in order to be able to effectively implement and support any kind of treatment recommendations.
And also, I was thinking as you were talking about sort of triangulating the data and seeing like where all the data points converge, your observation, how the student is, and school psychologists are really blessed with the fact that we can see kids in context. It's not bringing them to a doctor's office and how do they perform on demand for a doctor and
Really
when they're nervous.
important.
Really, really different, right? So you have a wider lens and you can kind of triangulate. But also, like as a parent myself, and seeing the difference of how my kiddos react in school to other things, the task demands are so different.
Yes.
Right? What my kids are expected to do at home in terms of focus and follow through and how much structure they get to do that is way different than what they have to perform on demand at school. So that's where I think the message, take-home message for school psychologists is don't forget to do all those great observations in multiple settings to see how that kid is across contexts and use that as another data point, right?
I think that's a great point, and I think that there's even the opportunity to bring the mother and child into your office as a school psych and say to the mother, why don't you get him to read this page to you? And see how the child reads, see how much he refers to the parent, see what his fluidness is like, and then you can use that as part of your conversation with the parent to support the data that you've collected.
Yeah, and I know when we were at UCSF in the autism assessment clinic, it was really interesting to see the parent and the child play together too. And so that might be another opportunity if you're lucky enough to have your own office school psychologists out there to be able to let's just get together and play a game together and see how much the child directs, how much the parent directs. Does the child try to include the parent? Is it my way or the highway? We're playing it this way. Sorry, mom, you're not even in the room. And get some flavor for that, how they interact and play too.
I think that's really important. And I think that sometimes using those data to reach the parent can be a lot more meaningful and direct than saying, well, this test shows that his social initiative is at the 25th percentile.
Right, you can use an example. Remember when we were playing together and this happened and you have a joint experience that you're aligning with the parent on, I saw that too.
Right.
That's really important. So another question that a school psychologist had that wanted me to ask you is that she's at the middle school level and she's getting a lot of referrals for, quote, high-functioning autism. The student is having a hard time socializing or making friends, or maybe it's on the quirkier side, and she's seeing a real surge in that. Can you speak to, first off, the label high-functioning autism and kind of why she might be seeing that kind of rise in referrals?
Yes, this is really tricky. One of the things that I talk about in the Politics of Autism is what we call diagnosing for dollars, meaning that sometimes parents get the idea that if the child has autism, they're going to get more services. Also, autism, as scary a diagnosis as it is, we often see middle schoolers and high schoolers starting to show early signs of psychotic disorders, and autism actually sounds a lot better than suggesting to a parent that the child has an early stage form of schizophrenia. And that is, as we know, like 1% of the adult population. So those are differentials you have to take into account. Also, kids who've had learning differences, as they become older and more self-aware, more depression and anxiety and low self-esteem can get them to pull back from peers in a way that they didn't at an earlier age. So what's really important, and this goes to your question, is getting an early history. If you're talking about a child who never had a 504 plan, never had an IEP, was never in a special day class, didn't go to private speech therapy when he was under 5 years old, then this is more likely a psychiatric disorder that's starting to emerge than it is autism that never was manifest. And so if there's good examples of this child socializing and doing things that show executive functioning and theory of mind, like playing team sports when they were in 2nd, 3rd, 4th, 5th grade, it's not that suddenly this has turned into autism. So yes, autism looks different. but usually you're not going to see signs of autism being suggested for the first time in middle school or high school.
Okay, that's really interesting. And speaking of assessment, I'm seeing a zeitgeist in the school psych community around the ADOS. Can you speak a little bit about the utility of the ADOS? I know a lot of times it's sort of seen as the gold standard of assessment. Can you speak to its value and whether or not an ADOS is necessary to make an, at least for a school psychologist, a diagnosis of autistic-like for services? What are your thoughts?
Yeah, so an ADOS can be very useful, but it's a tool, and that's all it is. Recently, Catherine Lord, who developed the ADOS, won just about a week ago the International Society for Autism Research Lifetime Achievement Award, which was well deserved. But interestingly, what Dr. Lord said as she accepted this was that this is just a tool, and that the ADOS is one way of measuring a child's autism symptoms. But it's important, and I always, when I'm training people on the ADOS, I always remind them that there are symptoms of autism you may not see on the ADOS. A child's insistence on routines, a child's narrow interests, a child's stereotype motor movements might not even come up in the course of an ADOS. So you can underestimate symptoms, but more importantly, and I think more often, a child working with an unfamiliar examiner or going into a room they've never been in before or having to leave class during something that they didn't want to leave class for, that child is going to look more withdrawn, more anxious, less communicative, and those are all going to translate into scores of at least a 1, if not a 2, when you go to look at social interaction criteria when you rate the specific criteria on the ADOS. So the ADOS has to agree with other data that you have, and it's not a gold standard, and that it's just plain wrong to talk about it as the gold standard for autism diagnosis.
Yeah, it's a piece of data that you can use to, again, we were talking about triangulating that data, getting multiple sources and multiple observations and rich developmental history.
Right.
Something that's really been, of interest to me, and I haven't read the book yet, I must admit. However, I'm sure I will read it like Harry Potter because everything she's written that I've read before has been really fascinating. But I know you talk a little bit, and this is really pertinent for school psychologists out there, about inclusion. And I know that school psychologists have such an important role to play in what's in the best interest of this kiddo, right? So yes, we are tasked with, are they eligible or not for special education services? But once they're, sort of in that, there's the menu of options open up. And what are your thoughts on the inclusion movement? I know that's something you talk about in here that I think is controversial, but worth discussing.
It's controversial, worth discussing, and the chapter that I wrote about it is called The Illusion of Inclusion, or The Illusions of Inclusion, and that sort of shows you where I'm coming from, which is that, yes, IDEA says that children should be educated in the least restrictive environment, but a knee-jerk response that a mainstream class is always the least restrictive environment needs to be thought about carefully, which is that if you have a child who basically has a classroom within a classroom, has a one-to-one aide, providing different curriculum for him in a one-to-one classroom, that is not LRE. That child is in a very restrictive setting, and usually in a very poor quality special education, because we all know that paraprofessional aides do not have the training that someone who's done a master's degree in special education does. And so the parents often don't realize that and push for their children to be included. There's a lot of parent groups online that tell parents to push for inclusion, and children need to be included with developmental peers. The curriculum needs to be within reach. In other words, developmentally, I always say to parents, if you want your, for example, this week I saw a 7th grader who's reading tests at the 1.5-year level, and he's pretty good in math, and so his parents want him fully included in middle school math. But if he's reading at the 1.5-year level, when teachers give instructions in that class, he's not hearing them the way a 7th grader hears them. And he doesn't even hear them the way the other kids in his mild, moderate class hear them. He needs his own personal invitation with visual supports in order to follow directions. And if that's his learning style with the material, he has to be in an environment that provides him with that. And that's not going to happen in a mainstream 7th grade geometry, trigonometry class. So it's that within reach curriculum. It doesn't make any more sense to mainstream an 8-year-old in second grade if it's like putting a 3-year-old into a second grade classroom. They can be a really bright 3-year-old, but there's going to be a lot going on in terms of both verbal and nonverbal communication and assumption of a knowledge base that's just going to go over their head. And that actually, not only does it not promote their education, but socially you begin to feel left out. And I think there are other risk factors in the politics of autism, in the illusions of inclusion. I talk about two things. One, we hear a lot about bullying, and bullying can happen if you're not with the program. But the other, which I think is equally sad to me, is what I call mascotting, where the child with the disability, other children kind of shush the child like they would a baby sister, or give them a disapproving look like they would a baby brother who's holding up dessert being served because they still want to fight about some battle that the siblings consider over. So I think that inclusion is very overused in many settings. But sometimes sometimes it is an appropriate program, and I've found, strangely, when I blog about it, I blog on Psychology Today, that people tend to see it in black and white. They seem to see inclusion as a civil right, and that if the parent wants inclusion, they should have inclusion, and that it's me, the school psych, who has to make it work. And sometimes parents put that on you, but you're the developmental expert, and you have to decide whether that's really appropriate for the child's learning.
I think that's really important. When we assess kids, we can see what developmental level they are compared to their chronological age. And if they are reading at a first grade level and we're trying to have them in a class that's a 7th grade level, I mean, that's something I think a parent could really understand, just the way you explain that. So you're welcome to mind the way that she's explained it in your consultations in IEP meetings about, imagine you're reading at a first grade level and you're in a 7th grade class. Is that the within reach curriculum? And I like that term, within reach curriculum, because yes, it's good to, expose students to challenge, but not so much that the gap's too wide. They can't reach it.
I mean, it's interesting that you mentioned that, because it makes me think of something else that I talk about sometimes. Sometimes if there's a younger sibling, so this little boy I just mentioned who's a 7th grader now has a 1st grade sister who already reads better than he does. Mm-hmm. And when you meet with parents, to be able to say, well, boy, I saw how his little sister's reading, and she's a great reader. And don't you think she's reading better than he does? And of course the parent is proud of their younger daughter and will say, yeah, I have to admit, she does read better. And that's what then you can say, that's what I mean by a 1st grade reading level. Mm-hmm. And that somehow, it brings it home, but it also in a way assuages that narcissistic injury of, why can't my other kid read? Is it something I did? Mm-hmm. Because then they have another child who says, no, your kids can read. Mm-hmm. It's him, it's not you.
Yeah, and I'm sure we could talk for ages about how to work with parents on presenting information. Likely as a school psychologist, unless you're working at the preschool level, you're not the first person to kind of present the news, right, of diagnoses and things like that. But is there any advice that you have, parting advice for school psychologists in working with parents and families of students on the spectrum? I know it's a very large question, but school psychs are often in the front lines of being able to help students over time. And if we can talk a little bit before we go about how that differs from, say, I got my diagnosis from a doctor and then we're done. Right. What value does a school psych have if we can frame up for them the long view for them?
Perfect. In the Politics of Autism, I talk about what I call diagnose and adios, and that's the medical model. Most of the clinicians who are physicians or clinical psychologists working in a medically based autism clinic, they see the child, they do the ADOS, they do a bunch of other measures, maybe they refer the child for a research study, they might send them to genetics or neurology, and then it's adios. The child is never expected to come back then. And the parents are this is the moment that parents have the most questions about, what do I do? And in a way, for school psychs, I think you're the ones who are in the position to be those navigators, which is, as you do triennial reassessments and go through that child's whole psychoed profile and how it's changing, that's when parents need to hear is this child on track to develop speaking in paragraphs or reading in paragraphs? Is this child ever going to have the same level of adaptive behaviors if he's in a moderate SH class? And that the child needs to be steered. And again, another chapter in the Politics of Autism, I talk about educating children with autism for their futures. And even though IDEA now allows us to wait until a child is 16, which I think is way too late to decide whether they should be on a graduation track or not, used to be 14, it really, to me, should be maybe 8 or 12, that when they go into middle school, we already know who the kids are who are going to be able to benefit from accommodations of core curriculum and who really need to have more functional academics and life skills. And we need to be educating parents about this and where it's going to take their kids, because importantly, if we look at the adult data on autism, and some of you may already know this, but some of you might not, 90% of adults with autism are unemployed or underemployed. And that includes the high functioning ones who have master's degrees and so on, as well as the really severely handicapped. 85% are living with their parents. Now, some of this is because we don't have good adult community options, but some of this, I think, is because nobody took responsibility for helping parents steer their kids and look for alternatives where there would be niches where their kids could fit in as they acquired skills in high schools and beyond. Because an 18 to 22-year-old transition to adult living program is not the first place that a child should be starting to get life skills if they don't have them yet.
I think that's really important, and we're going to have to leave it there because my coffee chats are meant to be enjoyed on a coffee break. So I do have a parting gift for you over there. It is a Thriving School Psychologist mug that you'll love it, because on the back it says, I never get invited to any meetings, said no school psychologist ever. Right? But now you have a meaning for these meetings. These meetings are really, you guys play such a pivotal role in helping parents come to terms with diagnoses, to understand their kids' challenges, to help teachers understand, to reach and teach them, and to think the long view. We have a really important role as school psychologists, and I am so grateful that you got to come and have a coffee chat with me and pick up the Politics of Autism. You're one Google search away from finding out where it is, and it's Bryna Siegel, but I'll post the link below. So thanks so much for joining me.
Thank you.
All right, bye you guys.